A new study out of Stanford University finds among teens and young adults who were tested for COVID-19, e-cigarette users were 5 to 7 times more likely to be infected than non-users. Several lawmakers are now urging the FDA to temporarily pull all e-cigarettes from the market during the pandemic. Joining me with more on this request is Illinois Congressman Krishnamoorthi, who is chairman of the House Committee on Oversight and Reforms, the subcommittee on economic and consumer policy. I read this study several days ago, and what shocked me most is we think about young people being asymptomatic, not getting so sick when they get COVID-19, not if they are vaping. These are 13 to 25-year-olds who are really negatively impacted. So what can you do in your position?
Well, thank you so much for your attention to this issue. Back on April 1, I asked the FDA to temporarily clear the market of e-cigarettes because we felt that e-cigarettes would only contribute to young people contracting COVID-19. Now we have further evidence from the Stanford study that if you vape and you are a young person, you are 5 times more likely to contract COVID-19. And if you vape and you smoke, you're 7 times more likely. And right now, as you know, throughout the country, young people are the group that are propagating or spreading COVID-19. And so for them to now be more likely to contract COVID-19 if they vape means that we have to temporarily prevent them from vaping.
I think the big question right now is what is the likelihood of this happening? It seems like a dramatic, if not sound, request.
Basically, we are waiting for the FDA to respond to us. We asked them to respond as soon as next week. We want to make sure that the FDA understands the urgency of this issue in light of this data. More data is even coming out showing that if you vape or you smoke, you're more likely to contract a more severe form of COVID-19 than otherwise. This is a very serious issue.
But the FDA has not really responded before. I mean, even before COVID, we knew that people were suffering with asthma, seizures, bronchitis, pneumonia, even collapsed lungs from vaping. And essentially, whether the doctors put this research forward or not, nothing was being done from a regulatory perspective.
So far, the Trump White House and the FDA, unfortunately, have not taken youth vaping seriously enough. Last fall, I'm glad that in response to pressure from my subcommittee, they decided to clear the market of certain flavors, but they left a huge loophole, namely the menthol or mint loophole for vaping, and that, of course, that appeals to young people. They also allowed for disposable e-cigarettes. And so now what I would say is not only do they need to close those loopholes, but they need to pull all vaping accessories and e-cigarettes off the market because we're in a public health emergency, at least for the pendency of this emergency. I make no judgment or we're not saying anything about after this public health emergency, but at least right now, we should temporarily clear the market of e-cigarettes.
There are a lot of people who vape, and many of them will tell you, look, I'm not smoking, and so it's healthier for me to vape. There's not really enough research to determine that vaping is the big problem that many people think it is.
Well, actually, we don't have evidence that vaping is safer than smoking. That is something that the industry is going to have to submit to the FDA as part of what they call the pre-market clearance process in the fall when they undergo further scrutiny for further sales. However, for right now, we are most concerned about vaping among youth. And because of this evidence from Stanford University, where they looked at data from more than 4,300 people between the ages of 13 and 24. So more than 4,000 people are part of this study. They said that those who vape are much more likely to contract coronavirus, and because those people get sick, the rest of us get sick during this public health emergency. We can't afford that. The pandemic is out of control in certain parts of the country, and this group of people, the 13 to 24-year-olds, are the ones that are propagating it, and we don't want them to get sick at higher rates than otherwise.
Representative Krishnamoorthi, thank you so much. And we'll continue to follow this, of course, and the FDA's decision about e-cigarettes. Thank you.
Thank you. Thank you.